Hello, I'm Josh Barker with the New York Amsterdam News, and with me today is U.S. Surgeon General Dr. Vivek Murthy. He's going to be speaking with us today about the issue of COVID-19 vaccinations in the Black community. I'm sure you all know that there's a very big issue going on here in this country when it comes to COVID-19 vaccines and African Americans, and we're going to discuss that today with the U.S. Surgeon General. Dr. Vivek Murthy, how are you doing today?
I'm doing well, Josh. How are you?
I'm doing great. Thank you so much. So go ahead and please tell us a little bit about, first, kind of lay down the groundwork as to what exactly is going on with COVID-19 and the Black community. We're seeing some disparities. Not a lot of our folks in the community are getting it. By the way, I just have to tell you that I'm vaccinated, but a lot of folks are still a little uneasy about getting it. Tell us about that.
Well, thanks, Josh. Well, listen, we have obviously for the last year plus been struggling as a country with this terrible virus, with COVID-19. But what is really a blessing at this point is that we've got a way to fight it. We have a vaccine that is not only safe and effective in the studies, but has been given now over 300 million times to people in the United States alone. That's how many doses have been administered. But the way we're going to succeed here is not just based on the number of doses we give, it's how fairly and equitably we distribute those doses. We can't leave any community behind, whether it's the Black community, the Latino community, the Asian American community, or any community. And that's why one of the things that we're doing is we're tracking our progress in the equitable distribution of the vaccine. One of the concerns I think all of us have had from the beginning is that COVID-19 has disproportionately hurt the Black community. A disproportionate number of our Black men and women and brothers and sisters have been hospitalized, have gotten sick, and certainly have died from this virus. And so in my mind, that makes it all the more important for us to focus our vaccination efforts in the Black community, make sure people have the information they need, make sure they have access to the vaccine. And we know on both fronts, with information and access, that there have been challenges, that there are a lot of myths out there that are floating around about what the vaccine does. And we should talk through some of them because I want people to know what the truth is on them. But there's also questions that have arisen about whether it's still important to get the vaccine. As you see cases going down and people may think, hey, I'm young, healthy, do I really need this? The answer is absolutely yes. It's still important to get vaccinated. The virus has fooled us many times. Cases have come down and gone up again. We're seeing dangerous variants develop around the world, which makes vaccination even more urgent. But finally, Josh, the myths. I just want to spend a moment on that because they're out there, and let's talk about them. There's the myth number one is that the COVID vaccine causes COVID, and it absolutely does not, because the vaccines available in the United States, they actually don't have the virus in them. So they actually cannot cause COVID. The other myths that you're hearing are that the vaccines cause infertility or mutations in your DNA. Those are categorically false. There's no evidence at all that they cause issues with fertility. In fact, many people have become pregnant actually after getting the vaccine, and many people have been vaccinated during pregnancy, and the more growing data that we get continues to tell us that it's both safe and effective during pregnancy. And there's also no way in which this causes mutations, because it's not DNA, which is your genetic code that's being injected into you. It's actually a copy called mRNA, which is almost like the instruction manual that tells cells for a short period of time to produce something called the spike protein, which is part of the virus. That's what helps your body build immunity, because we build an army of antibodies against that spike protein, and then the mRNA disappears. So there's no issues with mutation. And finally, there's a myth out there, if you've gotten sick with COVID, you don't need the vaccine. But here's what we know. We know that people who get vaccinated actually and get both shots of their vaccine, if they're getting the Pfizer or Moderna, they have a higher titer of antibodies. In other words, they have a bigger army of immune defenders than people who just get naturally ill by getting the virus in the community. And especially with the variants that are circulating, like this Delta variant we've been hearing about in the news, those higher titers of antibody became all the more important, because these variants can sometimes evade immune protection. So anyway, these are a few of the myths that are important to just understand, because they're out there. If you've heard them, know that they're false. If you have friends who mention them, please share the facts with them as well, so that people can get the info they need to get vaccinated.
All right. And I've heard a lot of those myths that you're talking about from people that I know who are just so hesitant. But there's also a, I guess, historical note to this that we have to mention. A lot of times we hear about some of the things that have happened in the Black community and the medical community. We hear a lot about the Tuskegee experiment. We hear a lot of other things as well. What's your response to that? Because we can't deny that there is a history of medical mishaps that have happened in the Black community. What's your response to that? Because that seems to be a reason why a lot of African Americans are a little afraid to get the vaccine.
Well, Josh, it's real, and we've got to be open about that and got to be honest about that. There has been mistreatment of the Black community in the health system and in research in the past, and even in the present. There are elements of structural racism, like in the healthcare system, which mean that members of the Black community don't always get the kind of fair treatment or care that they need and they deserve. And that's a reality we have to grapple with as a country. We can't shy away from that. We got to confront that. But to my mind, that's also why it's so important that people have a chance to hear from those they trust. It's one of the reasons why having representation of the Black community in the medical profession is just so important. Even before COVID, this is important. We've got to do a better job there. But what I would say is that at this point, the reason that millions of people in the Black community, the Latino community, the Asian American community, and other communities have gotten vaccinated is because they've looked at the facts. They've seen what happens if you don't take the vaccine. And this is a really important point I want to make, Josh, is we sometimes overweight the consequences of our actions and underweight the consequences of inaction. So not taking the vaccine is a choice, right? And what it means is that we are more susceptible to the virus. And what we know for sure, based on a year plus of painful experience, is that getting the virus is no joke, that it is a serious experience, that it has killed nearly 600,000 people in our country. Yes. It's left many people with long COVID symptoms, shortness of breath, fatigue, and other complications. So this virus is serious, it's real. We know that, and we know it's disproportionately hurt the Black community. We have an opportunity to help correct that by getting people vaccinated. That's why we really want people to get the information and access to the vaccine so they can be protected and we can move forward as a country.
Absolutely. And you're right, the COVID-19 has impacted the Black community at a disproportionate level. We've lost so many in our community. What I'd like to know from you is there are efforts by the White House, by the administration, by your office to reach the Black community. I know I was told that you're trying to reach folks in barbershops and churches. And I just want to say that I did a story this past week that a lot of African Americans are changing their minds about getting the vaccine. They're getting it because they're starting to see people that they know and people that they trust who are now getting the vaccine. But tell me about the efforts that the White House and your office is doing to try and reach the Black community.
Well, first, I'm just really happy to hear what you just said, Josh, that you're hearing people changing their minds. That's what I'm hearing as well, and we want that to happen around the country. But the way that happens, and the central part of our strategy, is to work with people in communities who are trusted. Trust is very local. It's about who you see. It's about who you know. It's often your local doctor or nurse. It's often the places that you go, whether it's barbershops or beauty salons or other stores where you see people again and again, you know that they're looking out for you. It's in your faith leaders and your pastors and in churches and your rabbis and synagogues. It's the people we know and see who we trust. And hearing from them can make a world of difference. And so that's why we're working so closely with those trusted messengers. That's why we launched the COVID-19 Community Corps a few months ago, which now brings in so many local organizations and individuals, gets them the facts and helps them reach out to their communities. Here's the last thing, Josh, that we know very clearly. We know that all of us are united by wanting to get past this pandemic. None of us want to go on for any longer than we need to, with more and more of our brothers and sisters getting sick. And what we want to do is make sure that, again, folks have access to information from people they trust. And so if you're listening out there and if you're thinking about getting vaccinated, please know it's still important. If you've got questions, you can go to vaccines.gov, get answers to those questions. But also know that if you've been vaccinated, one of the most important things you can do is turn around, talk to your family members and your friends and ask them if they've been vaccinated. If they haven't, then send them to vaccines.gov. They can find places around them where they can just walk in and get vaccinated on their own schedule. Help them text their zip code to GetVax, GETVAX, the numeric equivalent. They can get places, a number of places sent to their text to their phone that tell them where they can get vaccinated. So it's easier than ever to get vaccinated, but it's going to take all of us stepping up and talking to our family and friends, making that decision to get vaccinated. This vaccination effort is about more than what government can do. It's what we can do to help one another, support one another in protecting ourselves against this virus.
All right. And my last question for you is, How long do you think it will take to get back to some type of normalcy? Just real quickly, because I know we're pressed for time. How far away are we from putting this virus behind us?
Well, we've made so much progress over the last year. Even the last few months, you've seen the CDC say that you don't need to wear masks inside or outside if you are fully vaccinated. You've seen more and more workplaces come back online. You've seen, again, schools. A majority of schools in America, I know the school year is ending, but the majority of them are actually open full time for instruction. So life is actually returning to normal in many ways, and we will see that accelerate over the next few months if we get more and more people vaccinated. I'm hopeful if we do that, that we can see a life that looks fairly close to what it was pre-pandemic by the end of the calendar year. But it depends on what we do to vaccinate ourselves and our friends.
All right. Well, listen, thank you so much. I really appreciate you taking the time today to speak to our community about this very important issue. And thank you again so much.
Thank you, Josh. Thanks for all you're doing. Take care.